Have you ever thought about how important it is to catch health issues early? Welcome back to the channel. I'm really glad you're here because we're discussing a topic that can affect anyone, colon cancer. Early detection is key, and I'm going to walk you through the signs and symptoms that you need to be aware of. Understanding colon cancer. So, what exactly is colon cancer? It's a type of cancer that starts in the large intestine, or colon, which is the final part of your digestive tract. Colon cancer usually starts as small, non-cancerous clumps of cells called polyps that form on the inside of the colon. Over time, some of these polyps can become colon cancers. This is why regular screenings are so important. They can catch these polyps before they turn into something more serious. Early signs and symptoms. Colon cancer can be sneaky because it doesn't always present obvious symptoms in its early stages. However, there are some signs you should never ignore. Changes in bowel habits. First off, let's talk about bowel habits. If you notice any persistent changes, like constipation or diarrhea that lasts more than a few days, it could be a red flag. And it's not just about the frequency. Pay attention to the shape and consistency of your stool. If they become narrower than usual, it might indicate a blockage caused by a tumor. Changes in your bowel habits can be quite unsettling. You know your body best, so if something feels off, it probably is. Imagine your usual routine being disrupted by unexpected bathroom habits. This could mean anything from more frequent trips to the bathroom to experiencing constipation or diarrhea that doesn't seem to resolve. These changes might not be severe at first, but if they persist for more than a few days, it's time to pay attention. Rectal bleeding and blood in the stool. Seeing blood in your stool can be alarming, and rightfully so. It's one of the most common signs of colon cancer. While it can also be caused by conditions like hemorrhoids or other non-cancerous issues, it's something you definitely want to get checked out. Sometimes the blood isn't visible to the naked eye, but can make the stool appear dark or black, indicating bleeding in the gastrointestinal tract. Think about the last time you had a small cut. It probably bled and then stopped. But internal bleeding isn't something you can see or easily control. If you notice any blood when you use the bathroom, whether it's bright red or darker, it's crucial to consult a healthcare provider. Don't brush it off as a minor issue. This could be your body's way of signaling a serious problem. Persistent abdominal discomfort. Persistent abdominal discomfort is another symptom to watch for. This can include cramps, gas, or pain. You might also feel like your bowel isn't completely emptying. This sensation, known as tenesmus, can be incredibly uncomfortable and is a sign that something might be wrong. We all experience stomach aches now and then, usually from something we ate or a minor stomach bug. But if you're having ongoing discomfort, like cramps or gas that doesn't go away, it could be more than just indigestion. Imagine feeling bloated and in pain, with a constant sensation that you need to use the bathroom even after you've just gone. This discomfort can interfere with your daily activities and overall quality of life. Weakness and fatigue. Feeling unusually tired all the time? This could be more than just everyday fatigue. Chronic, unexplained fatigue can be a symptom of colon cancer due to internal bleeding and the body's effort to fight the disease. If you're feeling exhausted despite getting plenty of rest, it's worth discussing with your doctor. Fatigue is something we all experience, but the fatigue associated with colon cancer is different. It's not just about feeling tired after a long day. It's a deep, persistent exhaustion that doesn't go away with sleep or rest. This kind of fatigue can make it hard to get through your daily tasks and can significantly affect your quality of life. If you're constantly feeling drained for no apparent reason, it's a sign that something might be off. Unexplained weight loss. Another major red flag is unexplained weight loss. If you're dropping pounds without changing your diet or exercise routine, it might be because your body isn't absorbing nutrients properly, or the cancer is affecting your metabolism. Sudden weight loss is a symptom you should never ignore. Losing weight can be a goal for many, but when it happens without effort, it's a concern. Imagine stepping on the scale and noticing a significant drop in your weight without any changes in your diet or physical activity. This unexplained weight loss can be a sign that your body is not functioning as it should. Your body may be struggling to absorb nutrients, or the cancer might be using up your body's energy, leading to a noticeable drop in weight. Risk factors. There are certain factors that can increase your risk of developing colon cancer. Understanding these can help you be more vigilant about your health. Age. Age is a significant factor. Most cases of colon cancer occur in people over the age of 50. As we get older, the risk increases, making regular screenings even more crucial. If you're approaching this age, It's essential to start conversations with your healthcare provider about screening options. Family history. Your family history also plays a role. If you have a relative who has had colon cancer, your risk is higher. This is particularly true if a close family member, like a parent or sibling, was diagnosed. Knowing your family history can help you and your doctor create a more effective screening plan. Personal history of polyps. If you've had polyps before, you're at increased risk. Polyps are non-cancerous clumps of cells that can develop into cancer over time. Regular screenings and monitoring are essential if you have a history of polyp. Diet. Your diet is another important factor. Diets high in red and processed meats and low in fiber are linked to a higher risk of colon cancer. Think about what you're eating daily. Incorporating more fruits, vegetables, and whole grains can help reduce your risk. Lifestyle factors. Lifestyle choices like lack of physical activity, obesity, smoking, and heavy alcohol use can all contribute to the risk of colon cancer. Making healthier lifestyle choices can significantly lower your risk. This includes regular exercise, maintaining a healthy weight, quitting smoking, and limiting alcohol consumption. Screening and diagnosis. Let's talk about screening. Regular screening is crucial because it can catch colon cancer early when it's most treatable. Colonoscopy. A colonoscopy is the most effective screening tool. During this procedure, a doctor uses a long, flexible tube with a camera to view the inside of your colon and rectum. They can also remove polyps during the procedure, which can prevent them from becoming cancerous. It might sound daunting, but it's generally well tolerated and can be life-saving. A colonoscopy might sound a bit intimidating, but it's a straightforward procedure that can be incredibly effective. Think of it as a routine maintenance check for your body. The doctor uses a flexible tube with a camera to look inside your colon and rectum. If they find any polyps, they can remove them right then and there, which can prevent those polyps from becoming cancerous. It's a procedure that can save your life by catching problems early. Stool tests. Stool tests, such as the fecal occult blood test, FOBT, and fecal immunochemical test, FIT, are non-invasive tests that check for hidden blood in the stool. These are convenient because they can be done at home. They're a great initial screening tool that can indicate if you need further testing. Stool tests are a simple and non-invasive way to screen for colon cancer. These tests can be done in the comfort of your own home, making them very convenient. They check for hidden blood in your stool, which can be an early sign of colon cancer. If the test comes back positive, it doesn't necessarily mean you have cancer, but it does mean you need to follow up with your doctor for more tests. Flexible sigmoidoscopy. This test examines the lower part of the colon and rectum using a shorter tube than a colonoscopy. While it doesn't provide a view of the entire colon, it can still detect early signs of cancer and polyps in the lower part of the colon. A flexible sigmoidoscopy is another useful screening tool. It's similar to a colonoscopy, but focuses only on the lower part of your colon and rectum. This test uses a shorter tube and is generally quicker and easier than a full colonoscopy. It can still detect early signs of cancer and polyps, making it a valuable part of your screening routine. Prevention. Adopting a healthy lifestyle can help reduce the risk of colon cancer. Here are some steps you can take. Diet. Eating a diet rich in fruits, vegetables, and whole grains can lower your risk. These foods are high in fiber, which helps keep your digestive system healthy. Imagine a plate full of colorful vegetables and fruits, delicious and beneficial for your health. Your diet plays a significant role in your overall health. Eating a diet rich in fruits, vegetables, and whole grains can significantly lower your risk of colon cancer. These foods are high in fiber, which helps keep your digestive system healthy and functioning properly. Picture a vibrant plate full of colorful vegetables and fruits, not only delicious but also packed with nutrients that support your overall health. Exercise. Regular physical activity is another crucial factor. Aim for at least 30 minutes of moderate exercise most days of the week. This could be anything from brisk walking, jogging, biking, or even dancing. Regular exercise helps you maintain a healthy weight and reduces inflammation, which is associated with a lower risk of colon cancer. Exercise is not just about staying fit, it's about keeping your body in balance. Imagine taking a daily walk in your neighborhood or joining a local gym. These activities do more than burn calories. They boost your immune system, improve digestion, and help your body manage stress, all of which contribute to a lower risk of cancer. Avoid tobacco and limit alcohol. Smoking and heavy alcohol use are significant risk factors for many types of cancer, including colon cancer. Quitting smoking can significantly reduce your risk, and if you drink alcohol, try to do so in moderation. For men, this means no more than 2 drinks a day, and for women, no more than 1 drink a day. Think about how much healthier you'd feel if you quit smoking or reduced your alcohol intake. Not only would it lower your risk of cancer, but you'd also likely see improvements in your energy levels, skin health, and overall well-being. These lifestyle changes can make a big difference in your long-term health. Maintain a healthy weight. Maintaining a healthy weight through a balanced diet and regular exercise is essential. Obesity is a significant risk factor for colon cancer, so managing your weight can help reduce your risk. Imagine feeling lighter, more energetic, and healthier overall. By keeping your weight in check, you not only reduce your risk of colon cancer, but also lower your chances of developing other health issues like diabetes and heart disease. Treatment options. Treatment for colon cancer depends on the stage of the disease. Early detection often means more effective treatment and better outcomes. Let's explore the primary treatment options. Surgery. Surgery is the most common treatment for early-stage colon cancer. This involves removing the tumor and nearby lymph nodes. For more advanced cases, surgeons may need to remove a larger section of the colon. Picture this as a meticulous process where every effort is made to eliminate the cancerous cells while preserving as much of the healthy tissue as possible. Surgery might sound scary, but it's a very effective treatment, especially when the cancer is caught early. Think of it as a targeted approach to removing the problem right at its source. The goal is to take out the cancer and give you the best chance of recovery. Chemotherapy. Chemotherapy uses drugs to kill cancer cells and is often used after surgery to eliminate any remaining cancer cells. These drugs can be taken orally or administered intravenously. While chemotherapy can be tough, causing side effects like nausea, hair loss, and fatigue, it plays a crucial role in fighting cancer, especially in more advanced stage. Chemotherapy might bring to mind images of difficult treatments, but it's a powerful weapon against cancer. These drugs target cancer cells throughout your body, helping to ensure that no stray cells are left behind. While the side effects can be challenging, many people find the strength to push through with the support of their healthcare team. Radiation therapy. Radiation therapy involves using high-energy rays to kill cancer cells. It's typically used in rectal cancer and can be used before surgery to shrink the tumor or after surgery to destroy any remaining cancer cells. This treatment is precise, targeting the cancer cells, while minimizing damage to surrounding healthy tissue. Radiation therapy is like using a laser beam to focus on the cancer cells. It's a targeted approach that can be very effective in shrinking tumors and preventing cancer from spreading. Think of it as an extra layer of defense, working to ensure that all cancerous cells are eradicated. Targeted therapy. Targeted therapy involves drugs that specifically target cancer cell mechanisms. These drugs can interfere with cancer cell growth and spread, offering a more focused approach than traditional chemotherapy. Examples include drugs that block blood vessel growth in tumors, or those that target specific proteins involved in cancer cell growth. Targeted therapy is a more modern approach that zeroes in on the specific characteristics of cancer cells. Imagine these drugs as smart missiles, designed to find and destroy cancer cells while leaving healthy cells alone. This can lead to fewer side effects and more effective treatment. Thank you so much for staying with us through this important discussion. Remember, early detection can make all the difference. If you have any questions or need more information, don't hesitate to reach out to your healthcare provider. Stay healthy, stay informed, and take care of yourself and your loved ones. See you next time.